Hello.
Hello.
Hello. Very nice to meet you. This is definitely a first, I think. Well, firstly, huge congratulations.
Thank you. Yeah.
Is it a little boy or a little girl?
It's a little boy.
Little boy. He's so sweet. Oh, congratulations. What are the main concerns that mothers and potential mothers feel?
So the main issues that the women are having at the moment really are around sort of coming into hospital and worries about catching COVID, but also about the isolation after the baby's born. So they're having to self-isolate, so they're having limited support from their other family members. But actually, also we need to remember that most of the partners will be working from home, so they do have that extended support from the partner. But it's away from that anxiety around not being able to see their parents or their siblings. It makes it quite difficult for them.
And you're very aware of a difference or a shift in mothers' emotional and mental well-being in comparison to before the pandemic. Have you noticed a shift in that?
I think Joe might or Sam.
Well, there's a lot more anxiety. I think we're finding that there's women that have no mental health history that are actually becoming incredibly anxious because of the situation currently. So we're getting a lot more referrals in, which is specifically around anxiety to do with COVID.
Do they know where to go? Do mothers know where to go to get the right support particularly for emotional and mental well-being, do you think?
So the midwives are very good at signposting to local talking therapy services. We have the perinatal mental health team that we work with very closely within Kingston Hospital, and they have been sending out a weekly newsletter about coping mechanisms, about signposting to relevant services, and it's very, very rich information on there. So actually we circulate that out to the maternity unit so the midwives can use that to give to the women.
Yeah, it's probably such a valuable sort of tool. It's such a valuable tool for them now, particularly now. To you all there, you're doing an amazing job, honestly. As you say, babies come all the time. So, the fact that you're having to work in these in these difficult times, so well done. How are you all doing as well? Because obviously, there's worries and stress and anxiety out there for families anyway, but you're still working. There's extra pressure and worries, you're meeting families with extra pressures and worries and things like that, and also trying to wear this very uncomfortable kit by the sounds of it as well. So how are you and your families? Are you managing? Are you okay?
Yeah, there's the worry, but I feel once we follow in the guidance and we are wearing our mask especially, I feel personally secure. And then obviously we change out of our uniform, so we're not traveling with the same uniform we are at work.
The workload's still the same, but I think women are kind of surprised that our service is still available. I think we hear that, for example, supermarkets are closing, transport are reducing, they're kind of thinking, oh, maternity probably isn't open, but saying we're still open, we're still here, we're still well. So do come on in, we can support you as we can. I think a challenge maybe is more so for me as a screening midwife when we're giving kind of difficult news. So we get kind of the normality and the abnormalities. So I think in the aspect of having that face-to-face contact and being at a distance and having your mask on, not seeing someone's facial expressions and knowing if she might be hesitating to say something, it's a bit, but we're kind of working around it, and we're saying even with what's going on, we're still here to support you, we're still here to listen to you, we're still here to make sure we provide best care for your pregnancy, for your baby, and support your family also. I think it's reassuring for women to know we're still here.
Is this what it looks like, Sam?
Yes.
So
Smiling, can you tell?
I know, that's what's it with your eyes. Yes, I can. Do you see a shift? Are there things that are coming to the fore that perhaps haven't been so present before? Do you see the impact of the pandemic at the moment?
I think if I can pipe up here, we've got the platform, and I think the resounding feedback has been that there's they're nervous or embarrassed to reach out for health support now. And I think that is a message that definitely needs to come through, that we're very much open for business. Maternity services are here and ready for your call.
We need to do more to get the message out that mental health is important, and if you need help, get help. We're here to help.
Parents do need to go out and reach out to those who can support them, and particularly those who can provide, knowledgeable resource as well, which is what all of you are doing. But it's so right. We heard it from, the frontline workers and things like that. They don't feel, those who are struggling, they don't feel that they can reach out because they feel guilty for doing it, which is extraordinary to hear. But it's obviously with new mums and families and parents as well. They don't want to feel like they're overburdening, but it's so important to access and reach out for help when you do need it.
I think that's a really important point, that actually what we are seeing is that this is having an impact on all women everywhere. What would normally be very much a family event, or you would engage with friends or peers, is not happening anymore. So I think the mental health implications is huge, actually.
One of the important things that happens during a pregnancy is that face-to-face interaction with care professionals, the family engaging with the whole maternity system, and we have seen that impacted by COVID. As
organisations, you're playing such a vital role, giving key information. You're hugely trusted by the public in general, and therefore the information that you provide is a lifeline to a lot of people at this time. But what are the main concerns for pregnant women that you've seen? Is it this concept of I can't, or I shouldn't, I worry about going into hospital, or is it the isolation? What seems to be for pregnant women their main concerns?
Social isolation, for me, that is creating anxiety for women, because they know that they won't be able to see necessarily their parents, their wider family, their friends. It creates anxiety, because we all know how important those key relationships are in those early days around the birth and in those early days afterwards. So that's what I'm hearing.
Yeah. You speak to sort of 6 mums, and all of you realise are going through the same thing. Before that, you're worried that actually what you're experiencing is you're the only ones going through it, and it's exactly the same for new mums, whether through pregnancy or with a newborn baby. You feel that you're the only one actually experiencing something, but actually to be able to share it in whatever way, whether it's on the phone, through social media, in any form. Actually, if you have got access to it, it does provide that sort of normality and normalising some of these anxieties and these worries.
Yeah, I mean, I was going to say there's been a lot of discussion about supporting single neighbours, elderly neighbours, less discussion about looking out for new parents who may be very isolated. I think to get that message out publicly would be hugely helpful for families.
It's gone a huge way, I think, to the frontline workers. The small things go an awful long way, and the same for the elderly, having support with food, and it's the same for new parents. If you've just had a newborn baby, trying to manage sleepless nights and feeding your family, particularly if you've got all your other children at home and things like that. So the small things, the normalising things, I think go such a long way. So you're right, actually.
There are huge challenges for women out there in this crisis, that there is some positive bits of news that we absolutely can capitalise on, and there's huge potential for everybody being able to work together and continue to strive to do things that can make things very much better. And I certainly see amongst organisations, partly those represented here and many others, that people are talking to each other and working very hard with each other to raise awareness, to facilitate self-help, to facilitate better collaborative working, to really reach out. And I'm sure we can make a difference, but we've got a lot of work to do.